Hello and welcome to Dentelligent. My name is Michael Anger. In this video I would like to introduce you a very interesting technique. It is about the idea of using prefabricated implant abutments as primary telescopes. This is the idea of Dr. Valentin and Dr. Vollmer. In this case we use angulation-able, rotate-able and therefore abutments that can be easily parallelized from the implant system of Schützdental. These abutments are available in different angulations. We can choose between 0 degrees, 7.5 degrees, 15 degrees, and we hope soon there will be added a 30 degrees abutment, to be able to compensate still more divergences. In the cases we tested so far, it always worked with the angulations 0 to 15 degrees. The trick here is that this lower abutment part, you see here and here, is the interface to the implant, and the upper part of the abutment can be rotated variably, so you can select the appropriate angulation and twist the abutment so as to obtain a common inserting direction. The dentist can in this way already align the primary parts by skillfully selecting and turning the abutments in the patient's mouth to get a common inserting direction. Because all of these abutments have a very similar cone angle, so are almost identical, Dr. Vollmer and the company MR CAD/CAM Service UG have developed torque tubes which work on any of the different angled abutments. So basically convection outer parts or outer telescopes. In this picture you see the first generation, so the first test series of this experiment. In this image you see the new geometry, that is the geometry of the second series. Here it is desired to obtain a small basal gap, so the friction caps are be able to rely on the different abutments. This additional nose or bulk here, over there, serves to fix the abutment afterwards, safe in the tertiary structure, and now allows only one position in the direction of that nose. In addition, it is envisaged in the case of losing friction or the desire for higher friction, here from the basal fourth, there, necessary to position an individual screw and thus to be able to compress this cap target to change the friction individually. So we have here an almost individual copying as prefabricated caps for secondary telescopes. Here again the geometry in the occlusal view. This stage here round serves the tertiary structure, can be safely put on here so it does not detect a clamping effect. Here as described again this protuberance which can both accommodate the screw from the basal and the final positioning. So the dentist will now dial in the mouth corresponding abutments, looking through clever positioning that they are parallel and don't disturb each other in the inserting direction. Finally, the friction caps will be placed. A bite record was made of plastic, so that takes over the function of the jaw relation and releases free spaces in the area of the implants. The caps were now fixed with a light curing resin at the bite record, so we have a steady, well-fixed jaw relation template. With this jaw relation template, the impression was now taken simultaneously. So both functionalities in one piece: the bite and the impression. Here again the view of the parallel-based abutments. These were occlusal closed with plastic. We see clearly this is a 0-degree abutment and this is an angulated abutment. Based on the fact that the screw is still in the cover up here, we see here it is a 7.5 degree abutment. Once again the view from the other side. And here the first put on of the friction caps. In the laboratory a model with plastic stumps was made. These plastic stumps, in this case from the material Picoplast, the company Bredent, fixed the exact position of our secondary telescopes, so our peak caps. Here the model with applied peak caps. You see we placed these bulges always from distally, if that is possible. If once the implants are too close, we can simply turn this to the other side. Once again from a different view. Here these peak caps were signed numerically with points, but this is not necessary since they are interchangeable to each other. In the laboratory, two parts are made now. Firstly, a casted framework that loose rests on the peak caps and constitutes retentions for the posterior teeth. We like to use retention pearls because the bond with the plastic is stronger. Here again the casted frame from Basal. You see here the bearing surface for the peak caps. The second thing we make in this step is this part with the established teeth. Here again in the frontal view, and here the view of Basal. Here you see now the recess for the peak caps. The dentist will make the try-in for this formation in the mouth. Also makes the control of the bite. Then placing the peak caps in the mouth and check the fitting of the casted frame. Hereby you can easily find an error, any error, if the frame would not sit properly. This here now is still the first generation. The second generation we have deliberately omitted this occlusal portion to facilitate this control and to easier compensate if any slight errors. The peak caps will be fixed in the patient's mouth with panavia at the metal frame. Hereby the denture can be stabilized with the fingers, and by light curing the adhesive becomes fixed. Here the so bonded peak caps in the frame, and even the view from the other side. After that, the dentist can control the integration of this construction in the mouth. The seat and the friction are hereby immediately checked. Here now again the view of the second generation of our telescope caps. Now can be checked whether these bonded primary parts also fit on the original model. Should this not be the case, you can either make a pick-up impression or slightly individualize the plastic stumps and reduce them to make this work correctly sit back on the model. In the case that there are any inaccuracies in the jaw relation, we correct this with a silicon bite on the setup. With these bites we can correct the articulation in the laboratory. After correction the setup of the teeth, the prosthesis has now been completed. You see here the basal detail view of a completed telescopic prosthesis with peak caps. Very nice transitions between plastic and peak. You can also see this casted frame very well through the plastic. Once again here a picture from a different view. And here now the inserted telescope prosthesis in cover denture design. In this technique it does not matter how many implants the patient has. We can minimalized or even fully extended fabricate this kind of telescopic dentures very simple. For those of you who have counted, this work was only twice in the laboratory, namely once for the production of the model, the setup for the teeth, and similarly the frame, and once for the completion of the telescope prosthesis. Hereby we have of course saved enormous costs. There was neither an individual primary part produced nor a secondary part. It does not have a friction be made because the prefabricated material. So we can serve the patient with top quality prosthetics with telescopes on implants at a very reasonable price. I think an extreme intelligent idea, and sure I like to present you furthermore following cases. I hope you liked this post and wish you continued a successful training on your e-learning platform Dentelligent. Until the next video, I remain yours, Michael Anger.